Welcome back to your Daily Dose. Again, my name is Robert. I'm here with Susan and Indy and Bradley. We're having a wonderful discussion on all things Parkinson's and where we hope they go in the future. There's a brand new paper out right now called A Prescription for Wellness in Early PD, Just What the Doctor Ordered, written by Brad and Indu, as well as Gregory Pontone. And I want to get the name right. Is it Dr. Keener? Adrian Keener?
Yes.
Okay, wonderful. So here are some of the key points, the highlights that come right off the top here. And I'm going to start with, there's three. Here's the first one. It says, clinicians should have regular discussions about the psychosocial and mental health reactions their patients may be experiencing, especially at the time of diagnosis and at other transition points during the disease trajectory, and collaborate with and make appropriate referrals as a multidisciplinary team. There's a lot to unpack there. I just want to say that from my perspective, I love that because that moment, as it aligns with not only the improv but the storytelling, that's what we call the call to adventure. That moment of diagnosis can be very traumatic for a great number of people, and if at that moment it isn't handled correctly, it can send off all kinds of misdirections and unfortunate ideas about what may be next. So Brad, I'm going to open this with you. Why is that key point, in fact, number one? Why is it so important?
Yeah, I think there was a lot to unpack there. And when we look at we talk about it in the paper, this reactive depression, right? You get diagnosed with a chronic illness, you know very little about it. And I speak from experience with my mom, right? That she goes in, you have Parkinson's disease, and everything stops at that moment. You probably don't hear anything else your doctor says after that. And you go into this, my life is over. I'm depressed, I'm anxious, I'm fearful, all of these negative emotions, right? And frequently those things go unaddressed. And the one that we really introduced in this paper that the four of us really are fascinating by is this idea of demoralization, right? We hear about, everybody knows the word depression. You have an idea what that means, but demoralization is this different construct, right? Is it depression? Kind of, but it's really an inability to cope. And it's when someone feels hopeless, helpless, loss of meaning in their life, which is another area that I'm fascinated by. But these things, when they go away, the negative sequelae of that is terrible, right? You just begin this downward slope. And it's one of those things, it's not treated with a medicine, right? You can't give an SSRI or an SNRI and think demoralization is going to get better. It's really this piece of social prescribing that Indu has been talking about. And how do we get these people to begin to understand that there is hope?
Brad, let me pause you right there because I love that.
Yeah.
I saw Susan put her hand up. Susan, did something grab you in what he said? There was a lot. It was good.
Yes, the not quite depression comment that you made, it was exactly my experience. And with all the work that in the classes that I did with Robert, that call to adventure has a component to it, an aspect to it of positiveness. It feels like something. And I have realized in the work that I've done that the other things that you said, Bradley, that go along with demoralization, oftentimes are stories we're telling ourselves. They're not based on anything other than being trapped in fear or something, but they're not really like the movement disorder.
Yeah.
They're real, but they can also be compounded by getting trapped in your own story.
This is what's so slippery about emotions. And I love, Bradley, that you're diving into the specificity of emotions and unpacking them in a different way. I think, we flatten emotions and think there's only a couple of them, but when we go further and we realize, there's some fine definition, demoralization versus depression, that's spectacular. I have about 30 seconds. Do you want to wrap just on this real quick? We'll open up with more in just a minute. Go ahead, Brad.
Yeah, I think the key differentiator between those two, demoralization and depression typically is associated with anhedonia, right? Nothing I do makes me feel good. I can't have any pleasure in my life. Whereas demoralization is really defined as a subjective incompetence. Now that has a negative connotation to it, but it doesn't mean I'm incompetent with everything in life. It means I don't know how to cope with this new situation.
That's such an important distinction.
And that feeling that you said, Susan, is right on. And we heard that from throughout. And dude, just to end with you, just saying earlier, you talked about speaking to a lot of people with Parkinson's and hearing them. That's the inside out approach that it sounds like you guys are calling for as well. And certainly has been the basis of our work as well. These stories help us redefine the Parkinson's experience and then maybe redefine where we're going to go with it. I'm going to open with that in just a minute, Indy. That's going to be your go in the next one. All right. Hold on. Here we go. Back in the day a minute.